Millions of people take prescription medications every day, but many of them don't realize how these medications can have a negative impact on their blood sugar levels. This is even a bigger problem for those who are pre-diabetic or diabetic. If you or someone you know falls into this category, it's very important to be aware of the potential side effects of many of these medications, particularly an increase in your blood sugar levels. In this video, I'm going to list out 7 different medications from my clinical experience that can cause a spike in your blood sugar levels. Stay tuned. What's going on, family? This is Williams, licensed physician assistant, founder and creator of Health by Any Means Necessary, and I want to welcome you to our channel. We talk about all things health improvement, fasting, and insulin resistance. So if you're new to the channel, go ahead, hit the subscribe button, hit the like button, the alert notification. That way you can be notified when we release a new video. All right, let's get into it. If you're someone who takes medication on a regular basis, it's important to be aware of how these medications can affect your blood sugar level. So in this video, we're going to discuss 7 of the most common medications that I see patients taking that could be increasing your blood sugar levels. The first medication up is prednisone. Prednisone belongs to a class of medications called corticosteroids. Corticosteroids, often known as steroids, are an anti-inflammatory medication that's prescribed for a wide range of conditions. These medications are actually the man-made version of hormones normally produced in our bodies by the adrenal glands. And the adrenal glands are these 2 small glands that sit on top of our kidneys. Commonly, steroid medications are often used to treat medical conditions such as asthma, arthritis, and other inflammatory conditions. While these medications can be very effective at treating these conditions, they can also raise your blood sugar levels by causing more glucose to be released into your bloodstream. This happens because steroids both decrease the pancreas from releasing insulin into the bloodstream, and it increases how much sugar is released from the liver. The next medication, Sudafed. Sudafed belongs to a class of medications called decongestants. Decongestants relieve nasal stuffiness and congestion that many experience with the common cold. The most common oral decongestant is pseudoephedrine. Oral decongestants as a category has the most potential for affecting your blood sugar levels. These medications can increase your blood sugar levels in 3 ways. First, by decreasing the amount of insulin your pancreas is secreting. Secondly, by decreasing the glucose uptake by your peripheral tissues. And thirdly, by stimulating glycogen breakdown. Glycogen is the body's stored form of glucose, and so it increases that. Next medication up, Metoprolol. Metoprolol belongs to a class of medications called beta blockers. Beta blockers are a type of medication that are given to people for conditions like high blood pressure and heart disease. While they can be used in treating these conditions, beta blockers also decrease the release of insulin by interacting with the nerve signals to the pancreas, which then lowers the insulin levels even when blood glucose levels are high. The end result in this situation is higher blood sugar levels. Examples of other medications in this class include propranolol, atenolol, and carvedilol. Next medication, hydrochlorothiazide, also known as HCTZ. Hydrochlorothiazide belongs to a class of medications called thiazide diuretics. Thiazide diuretics are a type of medications that are used to lower blood pressure. These medications work by blocking the reabsorption of sodium in the kidneys. This causes potassium to be lost in the urine, which then can lead to a condition called hypokalemia. People who take this medication often need to take potassium supplements to make sure that their blood potassium levels stay normal. If the level of potassium in your blood decreases, it will interfere with the transport of glucose into the cells and also decrease the insulin from your pancreas. This will cause blood sugar levels to rise. The liver, muscle, and fat tissues are important places for glucose to be stored. If something interferes with the delivery of glucose to these tissues, blood sugar levels are going to go up. Next medication is atorvastatin. Atorvastatin belongs to a class of medications called statins. Statins are a type of medication that are used to treat conditions like high cholesterol and heart disease. While these medications can be used in treating these conditions, they can also cause your blood sugar levels to increase. Regular use of statin medications can cause as much as a 12% increase in blood sugar levels. How? Well, this is largely due to how statin medications can affect insulin in your body. Statin medications have been shown to make your cells less sensitive to insulin, and because of this, statin treatment is associated with a 46% increased risk of type 2 diabetes. Next medication up, amitriptyline. Amitriptyline is a type of antidepressant medication that works by blocking certain nerve chemicals in the brain that are linked to mood. This can help improve the symptoms of depression, but it can also cause a spike in blood glucose levels. This is because these medications cause your pancreas to produce less insulin. And finally, the seventh medication that could be causing an increase in your blood sugar levels are birth control pills, also known as oral contraceptives. Some birth control pills can also raise blood sugar levels. Examples of this include estrogen and progestin, as well as progestin-only pills. This is because they cause your pancreas to produce less insulin. Alright, so all of the medications in this video can raise your blood sugar levels, and it's important to be aware of these medications and monitor your blood sugar levels closely if you're taking any of them. If you notice a change in your blood sugar levels, be sure to talk to your doctor. Now, if you want additional help lowering your blood sugar levels and reversing type 2 diabetes, be sure to click the link below and get access to the Diabetic Toolkit and finally get the tools and resources you need to be successful. And the Diabetic Toolkit is completely free. Alright family, this concludes the video. I hope you enjoyed the information. I hope you got something out of it. Please make sure you subscribe to the channel, like the video, and share this with your family members who could benefit from this information. Until next time, I'll holler at you later. Alright? Peace.